Good afternoon, everyone. I am Pacharaporn Liangkobki, a first-year medical student. It's my delight to share about empathy decline and contributing factors across domains in medical student and resident in Phramongkutklao Hospital, Thailand. Empathy is both cognitive and affective understanding of a patient experience. It has been playing an important role in improving patient holistic care. However, research from many countries show that empathy levels tend to decrease consistently in medical students throughout their education. Okay. This may negatively impact the quality of patient care. Nowadays, research on empathy among Thai medical students remain limited. Therefore, we aim to focus on three domains of empathy according to Jefferson scale of empathy, which are perspective taking, the positive attitude toward holistic care, compassionate care, ability to understand patient emotion, and walking in patient shoes, immersing yourself in the patient experience and emotion. Our Sorry. Our outcomes are to access the empathy trends and to identify factors associated with lower empathy among Thai medical students and residents in a single center institution, which it had not been done before, leading to specified intervention for each medical year and empathy domain. A cross-sectional study was carried out at Phramongkutklao Hospital in Bangkok, Thailand, using a self-questionnaire divided into three sessions. First, demographic data, which is based on the previous studies, which are medical year, gender, preferred specialty, GPAC, and family relationship. Second, the Mosley personality inventory to access introvert, ambivert, and extrovert as the factors linked with level of empathy. Lastly, the Jefferson scale of empathy, divided into three domains with overall coefficient alpha was 0.82, and for each domain are 0.8 and 0.81 and 0.76 respectively, indicating a high reliability. The participants were second to sixth-year medical students and first to second-year residents, excluding those who did not sorry, including those who did not respond or complete the Jefferson scale of empathy. Then multi-variable linear regression analysis was performed. The study involved 342 medical students and 178 residents. We found that perspective taking and compassionate care declined over medical year to the lowest at 6 medical years and less up in residency. However, walking in patient shoes increased over medical years to the highest in second-year residents. For the multivariable analysis show that lower perspective taking scores were associated with being a resident and a clinical student and preferring procedural-oriented specialties. In the compassionate care domain, lower scores were linked to being a non-binary, a male, a clinical student, and a resident. Lastly, walking in patient shoes lower score associated with having GPAC over 3.5 and surprisingly, being a resident associated with a high score. The trend in empathy indicates that perspective taking and compassionate care tend to decline over the course of medical training. Therefore, adding intervention during the clinical year, especially in the intern who will become internship in other hospitals, could help sustain empathy level. On the other hand, working in patients' shoes which show consistent improvement could be further enhanced through early clinical exposure that would allow preclinical students to gain more experience and become better acclimated to clinical setting. Being a resident and a clinical student decreased perspective taking and compassionate care. These results may be attributed to high workload and stress, which relate to quick and self-perceived decision making without recognizing the patient want and emotion. The stress management intervention should be included in the curriculum. And procedural-oriented specialty do not typically interact with the patient, so they may prioritize procedure over relational skill. However, understanding the patient's background can increase the accuracy in diagnosis. And for technology-oriented specialties, they still need to interact with the patients like delivering bad news, so emphasizing empathy in these specialties remains important. Nowadays, the studies about non-binary are rare. The hypothesis proposed that emotional sensitivity resulting from experiences of gender discrimination may impact a person's ability to feel compassion towards others. Our findings also suggest that males tend to exhibit low compassionate care, which aligns with the result of previous study of systematic review of 30 studies, which indicated that males have low receptive to emotional signals. While many studies found no significant relation between empathy and academic performance, we found that those with higher academic performance negatively linked with walking in patient shoes. This might be caused by the difference in curriculum. Thai medical programs only prioritize theoretical knowledge over soft skills, leading to strong focus on academic performance while overlooking the patient needs. Therefore, adding soft skills to academic evaluation could promote more compassionate care. On the other hand, greater experience in patient care can give residents a deeper understanding of the patient situation. In conclusion, clinical students and residents tend to have low perspective taking and compassionate care due to high workload and stress. Should be included in the clinical and residency course. Interventions such as patient-centered workshop led by residents should be integrated in the preclinical and clinical courses to enhance all aspects of empathy, particularly in procedural and technology-oriented specialties. This would allow residents to guide clinical students while also reflecting on their own empathic behavior. In addition, integrating this workshop into the syllabus could also improve the lack of empathy in students who have a high academic performance, helping them better focus on the patient perspective. I believe the insight from this study could improve empathy training in many Thai medical curriculum. Thank you very much for your attention.
Thank you for your excellent presentation. It's very interesting, and I agree with you that your study might be might improve empathy along clinical year.
Thank you.
So, but I would like to ask about your discussion that it seems that when the time passed, the doctors in training seem to have low compassionate care. So you said about intervention to maintain the compassionate care along medical training. So, would you express more suggestion about these interventions and how frequent that the faculty will apply to maintain the compassionate care along medical training?
Thank you very much for the question. For the intervention to increase compassionate care in critical student, I suggest something like uh, health systematic science, which is currently in Phramongkutklao College. Medicine curriculum, which it allow pre-clinical students to access in the clinical setting by going to the hospital and gain understanding about how the patient feel. We give a lot of time for the clinical and preclinical students to talk with patient and doing a report about holistic care. So I think if we put this thing in the curriculum, it might increase the compassionate care in clinical student and preclinical student as well.
I've seen in your method that you include MPI in the study as well, right? And
Yeah.
how could you tell more whether how related or not about the empathy?
Oh. Why a lot of studies said that personality linked with level of empathy, but regretfully in our study, the relation between the personality which are introvert, ambivert, and extrovert is not significantly linked with the level of empathy. Is there any more questions?
I was going to ask that question, but it's a really interesting study, so can I ask another one?
Okay.
So looking at the sort of drop off of empathy scores and the empathy scores going slightly higher at different points,
You mean this?
Thinking about what that means in terms of practicalities, is there anything there that's very worrying, or is it just a slight drop, in terms of would anything strike up a red flag, for example, or do you think it's just part of the journey of going through medical school and training?
I think it's an important thing that it decline over the year. Okay, so we might put the intervention before it decline to prevent it from lower level of empathy. Okay, I think so. Thank you very much.